The illness took her mother, and then doctors told her she'd likely get it too. Angelina Jolie is making headlines this morning, revealing her choice to have her breasts removed in light of her increased risk of getting cancer. So was this a radical choice, or is it a reasonable and responsible one? For the answer, we go to Jack Cuzick. He's head of cancer research at the UK Centre for Cancer Prevention, and he joins us this morning from London. So, Jack Cuzick, do you think this was a good choice for Jolie, given her personal history?
Yes, she unfortunately has a very rare mutation in the breast cancer gene. It only occurs in about 1 in 1,000 individuals. And unfortunately, because of that, her risk of developing breast cancer is very high. And that, coupled with the fact that she also had a breast cancer in the family, means her risk is over 80%.
So can you tell me a bit more about the gene, this faulty gene? As you say, it's rare. What is it about this gene that so elevates the risk of breast cancer for some women?
Well, there are two genes, the so-called breast cancer gene 1 and breast cancer gene 2. Both are very rare. About 1 in 1,000 actually have these genes. And when they're there, when the mutation is there, the gene doesn't function properly, and it interferes with the body's ability to actually eradicate the cancer cells.
So if you know your own family history, or you know you have this gene, what are your options in terms of taking any prevention? Is surgery, a mastectomy, the only preventive option you can take?
I think it's very important to realize that there are now a whole range of options, not only for women who have this gene, but there are a number of women, in fact many, many more, that have a less increased risk of breast cancer, for which there are other options. They include taking drugs, just like many years ago people take a statin to reduce cholesterol, to reduce heart attacks. We have drugs like tamoxifen and raloxifene, which are now licensed to be used to reduce your breast cancer risk. It reduces it by about 50% or so. And there are studies of newer drugs which may be even more effective. At the even less invasive things, one can begin to do more regular screening with things like MRI, magnetic resonance imaging, which gives a very, very accurate picture. There are also simple things like taking more exercise lowers your risk of getting breast cancer by 20 to 30%, watching your weight, and avoiding hormone replacement therapy.
Okay, I just want to ask you, if the mastectomy is a viable option for you as a preventive measure because of your history or because you have this particular gene, why is it recommended for premenopausal as opposed to postmenopausal women?
Well, the primary reason is that this particular gene, this BRCA1 gene, actually leads to breast cancer early on.
Okay.
And if you have this mastectomy later, it may be too late. It may be that the cancer cells have already spread. So there is some benefit, but the full benefit is only obtained if you actually have the breast removed before any cancer cells have spread. And that's typically, around age 40.
And Jolie is writing that having the surgery drops her chances of developing breast cancer to 5% from 87%. Is that generally the case?
Well, her risk is certainly above 80%, and with this operation, with this bilateral removal of both breasts, you reduce your risk below the general population's risk, which is about 10%. So 5% means she's already below the average risk of breast cancer. And
again, Jolie is saying that she's going public with her story because she hopes that by going public she can help other women if they're faced with a similar situation and faced with making some difficult choices. What do you think the important thing is to learn from the choice and decision that Angelina Jolie has made?
Well, I think we have to recognize that breast cancer is truly the cancer epidemic of this century. It is the commonest cancer in many countries and in the world overall, and it's continuing to increase rapidly. And we really do need to make attempts to try to control this disease by prevention. Now, Angelina, of course, is at the very high risk, and she's chosen a very drastic measure. But I think it raises the profile of that there are things you can do to lower your risk of breast cancer, which aren't necessarily that dramatic. Some women, if they have this gene, will need to consider this kind of operation. But the whole idea of preventing breast
Right.
cancer rather than waiting for it to occur is very important.
Jolie is also advocating that genetic testing be available for all women. And I know in some jurisdictions it exists, but not across the board. What do you think? How helpful would this be?
Well, the testing is getting cheaper and cheaper and more available. But in fact, for the average woman, it probably isn't necessary because it's only going to show 1 in 1,000 cases. But what we should begin to do is women that show other factors of increased risk, particularly breast cancer in the family, should have a chance to have this test done, and that should be much more widely available.
Jack Cuzick, appreciate your observations and guidance today. Thanks for being with us.
Thank you.